Welcome back, my people. We are still on our topic about adenitis, and in this video we'll be talking about the signs and symptoms, or how will be a patient having adenitis present, or what are the clinical manifestations which a patient with adenitis will present with. And before we continue, let me appreciate you people for the support you have given me. You have actually become my family, and the growth of this channel is dependent on you. So for those who have subscribed and those who have not subscribed, the lovers and the haters, let's support this channel and make it a success. So I do appreciate your support so far. So what are the signs and symptoms of mesenteric lymphadenitis? So the symptoms of mesenteric, the word mesenteric refers to the abdomen or the abdominal wall or the abdominal cavity. So the symptoms will include the following. 1. Abdominal pain, which is centered on the right lower side, but pain can be widespread. Number 2, we have general abdominal tenderness. Number 3, obviously we have fever. Number 4, we have what we call mesenteric lymph node enlargement, and we have also diarrhea, and the last one, vomiting. It doesn't necessarily, if a patient is presenting with abdominal pain or vomiting and diarrhea, is not a must for it to be a mesenteric lymphadenitis. It can be also a sign of another disease or condition. So this is where laboratory tests come in. You have to pass through some laboratory tests or scanning to confirm, because some other conditions like appendicitis can present with the same complaints. So when should you see a doctor when you are having this kind of a disease? So you should see a doctor when the signs start getting worse. So abdominal pain is common in children and teens and can be hard to know when it requires medical attention. So see your doctor or call your doctor if your child has the following. Number 1, sudden severe abdominal pain. Number 2, abdominal pain with fever. Number 3, abdominal pains with diarrhea. Number 4, abdominal pains with a change in bowel habits. Number 5, abdominal pains with loss of appetite. Number 6, abdominal pains that interferes with sleep. If you look at all those signs and symptoms, they all include abdominal pain, abdominal pain. That means it's a serious condition for the abdomen. What are the causes? The common causes of mesenteric lymphadenitis. So, most common causes of mesenteric lymphadenitis is a viral infection such as gastroenteritis, often called stomach flu. So here, flu doesn't always refer to mucus in the nostrils, but it's a terminology that can be used to refer several other infections. So it causes inflammation in the lymph nodes in the thin tissue that attaches your intestine to the back of your abdominal wall, called mesentery. It causes inflammation in the lymph nodes in the thin tissue that attaches your intestine to the back of your abdominal wall, or mesentery. Other causes of mesenteric lymphadenitis include Number 1, bacterial infection, inflammatory bowel disease, and lymphoma. Guys, this marks the end of our discussion today, because this is a very short topic, and I hope you have understood all what we have discussed. In our next video, we will be discussing about diagnosis, or how you can tell a person is having this kind of an infection, and also the treatment, and more so the preventive measures that can be applied to avoid or reduce the risk of getting this kind of a disease. So for those who have subscribed, I do appreciate. We are almost at 10k subscribers. We are at 9.2, and I do appreciate your support. I never knew whether we will be here at this time of the year, so let's make sure by Christmas we hit 12k subscribers, and I know with your support we will achieve that. So let's keep the support on. Let's continue subscribing, liking, and sharing our videos. Have a good night. Thank you.